Again by Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health, and we always appreciate your time. Since March, I think we've been doing this, and we really appreciate your wisdom and your expertise. Let's start by setting the scene a bit. What's the status of cases and hospitalizations at South Shore Health as cases, as we've been reporting, continue to rise? And what are some of the challenges still, all of these months later, for medical staff? Have they changed?
Yeah, let me set this up for you, Maria. So we're seeing more cases coming in from the community than ever, meaning our emergency department is seeing about 3 times the number of cases that we often see. We're admitting more patients. And one of the issues is that because COVID is so frequent in the community, there's more and more chronic care facilities that are having these patients. So there's really a bottleneck here. It's becoming harder to discharge patients. So one of the real heroes are our hospitalists who are discharging patients who come in at a faster rate than we did in the spring. In the spring, these patients were staying in for 8, 10, 12 days, where now hospitalists are discharging these patients in better condition within about 4 days. It's tough right now.
So Dr. Ellerin, you said what 3? You've seen about 3 times as many. So is that the Hanukkah Christmas surge? It's probably too soon to be a New Year's surge, right?
Absolutely, and I do believe that this is a Christmas surge. We're almost at about 2 weeks past where we'd expect increased rates of hospitalizations. This is a problem, and I think we're seeing. Remember, just yesterday, there were 4,000 deaths. That's the highest number since the pandemic began. And there's more patients hospitalized in the U.S. than ever before.
The World Health Organization telling the European countries now they have to strengthen measures because of that new variant of the virus. We know that experts, everybody's saying it can spread much faster. But is there evidence that it leads to more severe cases or more deaths? Because that's good to know.
So this is what's confusing. If you're talking about an individual, then there's no increased risk of hospitalization or death. But because it's more transmissible, when you would normally have 100 people getting this infection, because it's considered to be 50% more contagious, now you have 150 people infected. So even though it's the same percentage of hospitalization and death rate, because the numbers are so greater, as a population, we're going to see many more patients hospitalized and deaths from this. So it is concerning.
So Dr. Ellerin, at the very beginning of this, Maria said, we appreciate you being here for March. Well, March is almost a year. So it's been almost like Groundhog Day, right? It's like the same day, the same thing, the same day, the same thing. So we know the mental health part of all of this is tough. The physical is tough too, but the mental health is tough. A lot of people feeling they need to escape. They want to book a vacation. It's January of 2021. What do you think? Do you have a recommendation?
Ed, I know you want to hop on a plane.
I want to hop on a plane.
And I want to hop on a plane too. But we see that prevention light at the end of the tunnel with vaccines. But for most Americans, it's not going to be months away till we start getting that. So, how can we endure more stress, isolation, anxiety? I think some of the ways we want to do it is connect to others, but at a distance, unless it's our own family. We want to take things one day at a time, understand that anxiety is real, and do things to help with your anxiety, whether it's writing things down, whether it's meditating, being mindfulness, and engage in activities that help others. Right now, we want to limit mobility. So hopping on that plane is not the best advice.
Not yet.
Not yet.
Not yet.
But there's light at the end of the tunnel, and that's good.
There is.
We have to believe that.
Great to see you, Dr. Ellerin, as always. Thank you for your time.
Thank you, Dr. B.